Hi, everybody. Thanks for joining us for PAAR Talks. We're really happy that you're here. My name is Susie. I'm a legal advocate at Pittsburgh Action Against Rape. And today here with me is Nikki, and she is from Mercy.
Good morning, everybody.
Hi. And so Nikki is a registered nurse that has spent the majority of her time and career working in emergency medicine. She's certified as a SANE-A, and she works at UPMC Mercy's emergency department as a clinician and as the forensic coordinator there as well. Thanks so much for joining us, Nikki.
Thank you for having me.
Of course. So can you tell us a little bit about your work at Mercy?
Absolutely. So I am the forensic coordinator, as we mentioned, at Mercy Hospital. And what this title means is that I help to head up a team of nurses who, above and beyond the responsibilities of their everyday job as emergency room nurses, have decided to get additional training so that we may assist patients that require forensic services. This could fall under sexual assault, physical assault, elder abuse, child abuse, anything in that range. They've attended not only additional schooling, but bear the responsibility of doing annual con ed to keep their skills up and to make sure that they are aware of the most best practice. So by heading that team, I help to coordinate so Mercy Hospital has 24/7 coverage for a SANE. Some days we have SANE nurses working within the department. When we do not, we cover with a call shift. So that way, either to come in person to the hospital or via phone for some resources for the rest of the staff, we have somebody available 24/7, 365 days a year. So I help coordinate that. I help oversee their continuing education. And in addition to that, I review all of the cases that come through, any evidence collection we do, any photographs we take for assault victims, any child abuse cases that may then continue on through the system. I help to coordinate that and make sure that the evidence we collect gets to where it needs to go.
Awesome. Thank you. And because I asked you this question just a little while ago, if you could answer it for everybody else, what does SANE-A mean? Because I think a lot of people are familiar with SANE, but that -A even threw me off, and I do this work.
So SANE-A means that I have a specialized certification in sexual assault for adults and adolescents. There are actually two certifications available. One is for pediatrics, which would be a SANE-P, and one is for the adult and the adolescent group. Each have different requirements in that you have to attend a 40-hour didactic course and then get, the number varies slightly between the two, but it is over 300 hours of recorded practice time before you're allowed to sit down for the actual national certification exam. And then upon passing the certification exam, you can then, add those letters to your resume. And so I hold that on my team. We have two other certified SANE-As. Our particular emergency department does not have SANE pediatrics because that is such a specialty that we will begin a case if it comes in through the emergency department, that the CAC over at Children's Hospital is truly the best place to deal with that, because those people have been given even more extensive training for both the physical and psychological ramifications of sexual assault in children.
Oh, okay. I see. Thank you for explaining that to me. So what can you tell us about your work with human trafficking victims and survivors?
So the big responsibility of the emergency department, it falls into one of two categories. One could be when a known human trafficking victim is brought into us. Our first responsibility is to make sure that they get both the medical care and the psychological care that they will need moving forward. And this may be somebody who, the police come across somewhere out in the community. And so we know there's a human trafficking link. Probably our bigger and tougher responsibility is for human trafficking victims that come into the emergency department that have not been detected as of yet. We often see them present to the ER with very run-of-the-mill medical complaints. It might be something as simple as abdominal pain or a back injury or a dental abscess. So our staff, in addition to our forensics team, even our regular staff has some additional training and have attended lectures on red flags, so to speak, in patients. Like a couple of big ones that I could say off the top of my head would be, We become concerned if we notice that a patient appears uneasy around the person that they have come to the emergency department with. In particular, a few more red flags in that realm would be if that person declines to leave their side, even tries to walk them to the bathroom, things like that. Or if we have patients show up and not only do they not have their own ID, but they don't seem to have knowledge of their own birthday, social security number, things along those lines. Those are all red flags that as emergency room personnel, we have been trained to, if we note them, explore a little bit further. And this may just lead at first into some questioning. One of the big challenges with this group is getting somebody who has been a victim for a long time and may have had their families themselves, been threatened for so many years that their fear outweighs any cry they may want to make for help. So our big responsibility is to try to gently extract this information. We may start with simple questions like, where do you sleep at night? Do you have a bed? Do you get 3 meals a day? Do you have responsibility for your own finances? Can you leave the house if you want to? And sometimes very simple questions like this can guide us into helping them be able to tell us a little bit more about their story. It's not without challenges. There are sometimes language barriers. There are sometimes social barriers for people who may have had very limited interaction with the outside world. Coming into a bright and shiny emergency department, that act in itself can be utterly terrifying. And then to have to talk with people that you've never met before and relay information to them that the individual victim may find humiliating. So it can be a long and arduous process, but we are there to determine those things. And then once we know that, what can we do for the victim? If they have a medical complaint, we obviously absolutely want to make sure that we address that. Unfortunately, human trafficking victims can often be in ill health due to poor diet or lack of medical care in general throughout their lives. The second step is, and we often do this in conjunction with our social workers and organizations like PAAR, is to what happens when they're done in the emergency department. They can't stay with us forever, and it may just be a few short hours that they stay with us. So starting them on the path to have a safe place to go and to begin rebuilding their life.
Absolutely. Yeah. Well, I'm so glad that you and all of your coworkers and everybody doing that work is there. That's really hard, but important work. So thank you. I think the last question that I have is, why is it so important for victims, human trafficking victims or otherwise, victims of sexual violence, to come to the hospital to get services? Why is that so important?
I can't even stress enough how important it is for a multitude of reasons. There are many steps into helping a patient and a victim move forward after being a victim of human trafficking. In the very short run, the first thing we can do is help give them back some power. And by giving them back power, we start them on the first day of them perhaps being able to move forward and heal. And when I say power, I mean, we let them choose. We never do anything in exam that the victim does not consent to. We let them choose what they are comfortable with. We stop as many times as we need to. Sometimes these processes can take all day, and that's okay. Because for the first time, perhaps in a long time, or maybe in perhaps someone's life, we are allowing them to make the decisions that they need to make for themselves. And out of those decisions comes very important things. Medical care is a very important factor in this, especially if there is an injury there that requires greater attention than just a dose of medication, an X-ray, a splint, things along those lines. There can be major medical things going on with people. So we get them the help that they need physically. But then we also set them up with the resources, as I mentioned. A lot of human trafficking victims, they don't know what comes next because they've never had a next. They don't necessarily have a friend they can go stay with. They may have no family here in the city, the country. They may have never been outside of the small home where they were being kept or outside of the neighborhood where it is that they are being human trafficked. So for us, it's trying to find them somewhere safe to go so they can start rebuilding their lives, moving on, and receiving whatever psychological help they may need to deal with all of the things that they've been through.
Absolutely. Very important reasons. Like you said, there's a whole list. And I'm sure there's so many more based on everybody's special case when they come into the hospital and see you. Well, thank you so much for being here today and talking with us about these things. We really appreciate it. And thank you everyone for joining us.
Yes, thank you for including me.
Of course. Bye-bye.